So how do you treat metabolic abnormalities in patients with PCOS?
Hello, good morning. I am Dr. KV Subramanyam, Professor and Head Department of Endocrinology, Andhra Medical College, Visakhapatnam. And as far as the metabolic abnormalities in PCOS is concerned, we know patients can have lipid abnormalities, patient can have obesity, patient can have hyperglycemia, and all this can be present in PCOS, and this may result in full-blown type 2 diabetes in the latter half of the life, and patient can also have full-blown dyslipidemia. And as far as PCOS is concerned, when the patient has these abnormalities, we have to take care of them and treat them. And first and foremost is the lifestyle. See, this lifestyle includes diet, exercise, and also stress relief. This also helps in not only controlling the metabolic abnormalities, but also in reducing the weight of the patient, and that may help in the in helping the improvement of the menstrual abnormalities. Apart from it, when you come to the lifestyle, we have the diet. Diet, we have three things. One is regarding the carbohydrate, then the protein, then the fat, and of course, we can divide in a practical terms into curries, then we have the potatoes, then we have the carbs. So as far as the potatoes are concerned, you have to stop entirely the potatoes. As far as the carbs are concerned, you should reduce the amount. So people have a doubt regarding what are carbs. Carbs means rice, chapatis, oats, ragi, everything is a carbohydrate, and most of the breakfast in all the Indian diet is also carbohydrate. So when you take this, you should reduce the amount of carbohydrate, because we cannot avoid carbohydrate in our life. So when you reduce the amount of carbohydrate, how much it should be reduced? People measure in grams, 50 grams, 100 grams, but it is very difficult. So what I say is, you have to make it half of the amount of the curries. So what are the curries? It can be taken. One thing is sabji, whatever the vegetables, green leafy vegetables, and the patient can also have eggs, fish, and chicken also. There is no problem. Only mutton has to be avoided, red meat, especially because that would influence the lipids. So apart from it, there should be regarding the exercise. Exercise is important part. How do you do it is entirely depends upon the age of the person and also your capacity to do exercise. So improve the physical activity, whether you want to walk, you want to run, you want to cycle, you want to skip, whatever it is, yes, you have to do it. How much time? First start and do it, and better at least 30 minutes to 45 minutes in a day, and at least 5 to 7 days in a week. So after this, reducing the stress. The most important point is try to sleep as early as possible, probably around 9 p.m. and wake up around 5 or 6 a.m. This cycle is most important as far as the relieving the stress is concerned. So after this, then we have other things. What we have is the medications. When the patient has more glucose, then we use something like metformin. If the patient has more amount of cholesterol, then apart from these things, we give statin. And there are some other medications which can be used with the advice of the doctor. So that's how we improve the metabolic abnormalities in a PCOS patient, and that would prevent the onset of type 2 diabetes mellitus, dyslipidemia, and other things related to the obesity. But prevention is the best one. Once you get it, again the treatment is again depends upon so many factors, and you can take the advice of the endocrinologist or your doctor. Thank you very much.